Now, have a think about patients who might be watching this, video later on, and they're getting some very useful advice already. But I wonder if there's any other tips you'd have from what you've been through that you could think, well, I noticed that this was a problem for me, and people should watch out for that. Or is there anything else that you can think that you would like other patients to know?
I think that if you feel that you want to, the hospitals normally give you quite a good leafleting area and support with breast care nurse that you can ring. I think for me, there was a drop-in centre at the local hospital where there were leaflets and people you could talk to, because at one point I didn't know whether I was going to be paid about my job and things like that. All those things help to add to your fear and anxiety in general around the illness. I wish I'd known that, for example, you didn't have to have your wig from the hospital site if you are an NHS patient. You could take a prescription elsewhere, mostly. I really struggled with the lack of support around my wig, unfortunately. It just wasn't there, and I had to go elsewhere. But I had to make a lot of inquiries before I realised that there was some flexibility with that. So I think it's important that you try and prepare yourself for that before your hair starts falling out, before your chemo starts. Even if you don't think you're going to have chemo at the beginning of your cancer journey, it might just be wise to explore those avenues before you start chemo, because you don't want the stress of chemo, dealing with hair loss, and then having to look around for your wig. So that's quite a good tip. I think as well, when your hair starts growing back, you should try and empower yourself by making it as funky as you can. If you've had long hair before, go for something really short and spiky, and perhaps a bright colour, even if you can cope with that, or it's not going to damage your scalp or cause you a problem, because then you've said to yourself, well, the cancer has taken part of me, but it's not taken all of me. I am still there, and I'm in the driving seat. So for me, that was quite a good tip to do. And again, I think if you are starting to get distressed and anxious, don't feel guilty about it. Don't feel that you've got to be professional about it, that you've got to be a professional patient who is not showing anxiety. Try and speak to the support network around you with oncology, because you might talk to your oncologist about certain things and say you're worried, and they are busy people. They haven't got long in their session with you to go through those things and ask if there are any support mechanisms around emotionally. Or if you don't feel able to do it, perhaps you can get a family member to do it.
So maybe one thing is to go and ask what resources are available wherever you're being treated.
Yes, because you do keep coming to the hospital, and it is a bit of a treadmill that you're on, and you keep coming for the chemo appointment, and yes, that's another one down, and you rush off out of the hospital. And the same for the radiotherapy, and the radiotherapy is quite intense, because some of them you have a lot of sessions every day, and it's a big part of your life, and it's easy to go down that road and be getting a bit depressed about it, a bit anxious without realising, and then all of a sudden, like myself, you have a sort of emotional explosion in the middle of it, because you've got to that stage and you haven't or been aware of any support mechanism emotionally for you there in place. I certainly didn't know that until I had this situation with radiotherapy.
Now looking back on your treatment as a whole, would you say you're satisfied with the care you received? Would you say the quality of the care you received was adequate for you?
I would say yes, to some extent, not in others. I think that I would have liked a lot more information at the time of getting breast cancer and going through the treatments. Nobody at any time while I was going through chemotherapy, for example, said, well, there are people that you can talk to about this outside of the medical treatments you're being given. Nobody said on that chemo suite. If you are getting more and more frightened about cannulations and coming physically into the chemo, it's become an environmental thing, into the chemo suite and things like that. Nobody at any time said there is somebody who psychologically could help you, or it's not wrong, the feelings that you're having, Julie. You don't have to bury them because you feel that they're bad or that they're not appropriate. You don't have to be the big brave soldier. You can offload that, and you've got every right to feel that way, and there is support for that. At no time was I told that until I'd actually broken down in a public in a public place. That was very distressing for me, because having gone through all that emotionally, I was in an area where I was just off a radiotherapy waiting area. Everybody could hear the fact that I was extremely distressed, and my husband had to be sent for to come to me because I wasn't physically capable of walking out of the room. And then I had to walk through a waiting area full of people. Obviously, having been very distressed, I thought that was the very negative thing, to have to get to that stage before help was looked at.
I think what's happening there, if I may, is that the staff are not picking up on something when it's in evolution, when it's bubbling up. And unfortunately, because of probably resources or focus on other things, they're not looking at those emotional sides the same way that, as you said earlier, it'd be nice if they did. But when things go into a kind of catastrophic level, suddenly they all realise, oh yes, we need to do something, and then everybody rushes around to try to help. But by that stage, it's a shame that it's got to that point, isn't it? Because in a way, the earlier you help somebody with almost any issue, the less severe that issue becomes.
Yes.
It's the same for psychological